Good morning, everyone, and welcome to the seventh webinar in the Sailing to Lisbon webinar series. This webinar covered the themes of conference that will take place in Lisbon in November. My name is Karina. I'm a public health resident. I'm part of the local support committee for European conference in Lisbon. Ricardo Mexia, our chair of this conference, is unable to enjoy and to attend today. So I will conduct this webinar, and I hope you enjoy it. To begin with, we'll show you a short video from Lisbon to our music, and I hope you enjoy it. Fado is one of the type of music that identifies Portuguese people, sometimes a little bit more dramatic, but very intense and beautiful. I recommend it to anyone who gets to the Fado house while in Lisbon. So come to Lisbon. It will be an interesting conference, and also we will enjoy it. This city has the people all the time enjoy it. So I would like to remind you. In the end of this webinar, we will have a quiz. As always, you can have the city to the dinner and dance, which will take place in the Stupa Fria. And without further ado, I will get to the stage our moderation, Monica. Just a moment, Monica and Marius, to lead this webinar, and I hope you enjoy it and to have a good discussion in this webinar. Thank you.
Thank you very much, Karina. Thank you for inviting us, and thank you for taking care of all the organization that is behind this webinar. My name is Monica Brenzak, and I'm honored to be joined by my colleague Marius Ungureanu, and for us to be moderators of this webinar. I'm representing EUPHANxt, which is the next generation of public health professionals, And I would like very much to see as many of you in Lisbon this November. I'm guessing and I'm hoping that the weather will be in our favor. We are making sure that you will have many interesting sessions to attend. And as a sneak peek, we are offering this webinar to see what you can enjoy in Lisbon outside of the Fado, the beautiful streets of Lisbon, and the very nice Portuguese people. And now I would like to give the word to Marius Ungureanu to welcome you as well. Marius.
Thank you so much, Monica. As Monica mentioned, my name is Marius Ungureanu. I'm the president of the Health and Care Workforce section of EUPHA, and I'm really privileged that our section, together with EUPHANxt, are hosting this webinar. As Monica said, just to give you a taste of what you will get to experience from a scientific perspective in Lisbon at the European Public Health Conference. Now, Karina really made us desire that November is much closer so that we get to enjoy the beauties of Lisbon. But coming back to our webinar, the title, I believe, says it all. So it's moving the health and care workforce discussion globally from data and information to action and back. And why we chose to discuss about this, because many times we see that we have a great divide between the research evidence on the one side with regards to health workforce and action, be it in the format of programs or policies on the other side. So we see that there are currently many efforts to bridge the data and the evidence on the one hand with the action on the other hand. But we want to make one step further, and we want to advocate for the fact that it's not only enough that evidence and data informs policy and actions, but that policy and actions will at their turn inform the evidence base or increase the evidence base. And so today we have three excellent speakers with a diversity of backgrounds that we will be presenting in a moment, sharing from their experience and from their expertise how we can do like this deep dive into the health and care workforce discussion from evidence to action and back. And now for introducing the speakers and then more specifically the first speaker, I give the word back to Monica, and I wish that you enjoy this webinar.
Monica, you need to activate your micro, sorry.
Yeah, thank you very much. Thank you very much, Karina. I guess that no one heard me. I was thanking Marius for the very good introduction, saying that regardless of the health systems in which we are functioning, humans should be always at the center. And I said that I have the pleasure of introducing Kasia Ptak-Bufkens, the policy officer in the unit in charge of State of Health, European Semester and Health Technology Assessment. Kasia coordinates the EU actions on health workforce, access to healthcare, and she contributes the unit's work on health systems for France, Luxembourg, and Spain. Before joining DG Sante, Kasia worked on labor and social policies in DG Employment and Social Affairs. Kasia, the stage is yours. Thank you.
Thank you so much for this great introduction. And yeah, it really feels like getting on the plane and the tram, local tram to travel to Lisbon with you. And thank you so much for dedicating one of your webinars to this very important topic of challenges we see in the health sector, and what is the core of the health sector are humans. I fully agree with Monica. I will try in a few minutes to explain you a little bit the policy landscape and the initiative we've been taking to help health workers to recover from the persisting actually challenges, because those challenges are not new. They have accumulated in recent years, and the COVID pandemic just exacerbated the problems with shortages of skills and human power in the health sector. Just to give you a short snapshot of the priority areas we've been busy since the pandemic, the Commission has been building actually the EU Health Union with the ambition to help member states coordinate the response to the health crisis, to build solid medical supplies, make sure they are available, affordable, also to help countries come together and improve the prevention, treatment, and aftercare if it comes to the cancer care, but also to the mental diseases. What is the landscape for the health workforce in all this, in this policy framework? We all know that we have critical challenges with shortages. This slide gives an insight to the problem of unequal distribution of health workers in the EU. It shows that here we have a quite unbalanced distribution between the countries, but also within the countries, with the phenomena of the so-called medical deserts. We also have an issue of working conditions. There has been quite some efforts to improve the data to show, to pinpoint to these challenges. And I put in my slides just one slide which actually shows how health workers are doing comparatively to other sectors. So you see very clearly from this slide, maybe it's a bit difficult to read, but you see very clearly that actually health workers suffer from the biggest job strain comparatively to other sectors. To give you an idea of what it means in numbers, over 50% of health workers struggle. So they assess their job as producing a lot of stress without optimal working conditions. Compared to 20% on average in the EU. So the challenge is very serious. What do we do at the EU level? I represent DG Sante, and DG Sante does not work in isolation, of course, addressing the health workforce agenda. The health workforce agenda is part of our social pillar, a pillar of social rights, which for several years now has put people at the core of attention of the policies related to macroeconomic governance. We realized in 2016 that even if Europe is actually one of the best places to live in terms protecting people, ensuring social protection, good working conditions, we realized that there are still inequalities, gaps, that there are still sectors where social challenges accumulate to a great extent. That's why the Commission decided to launch the social agenda, which is called the European Pillar of Social Rights. And the COVID crisis actually showed that the society has been shaken too much, and there were some sectors which were in particular suffering from this crisis. So we realized that more needs to be done to recover the labor market, to improve the working conditions in some sectors, and health sectors is actually one of those. next to the long-term care sector as well. On top of these more horizontal policies, we also developed some targeted actions, and this we have done internally in DG Sante. So these are our initiatives. I will talk briefly later on about them. We also try to enforce certain mechanism to strengthen the collaboration of member states. So I will also talk about our recent initiative in this area. And next to what we can do at EU level, we also have a policy and funding mechanisms to support member states in their country-specific perspective. Because what I didn't say in the beginning is that, of course, the health policies are according to the treaty, the responsibility of member states. So member states allocate the resources to health systems, decide how the health systems are organized. Our role is to help them in that. And we work with member states within certain policy framework and providing additional funds to member states. One of the recent policy initiatives which we've taken at the horizontal level is the action plan on labor and skills shortages. And health sector is actually one of those sectors which is a target of this initiative. What is the idea of this policy initiative is to actually involve better social partners in our efforts to improve the working conditions and to address the huge challenge of labor shortages. This initiative is actually proposing 88 specific actions. Some of them are not new, but they need a fresh start. There were, for some reasons, some of these initiatives have not produced the expected outcomes. So there were certain factors which actually did not allow to exploit fully their potential. There are also new initiatives which are announced in this action plan. And as far as the health sector is concerned, the initiative is actually launching 3 projects which are related to healthcare. One of them is the EU for Health Action to address shortages of nurses in the EU countries and associated countries. The other one is the mental health survey for health workers. So we will launch a survey which will give us better data on the mental status of health workers. And another one is also cross-sectorial guidelines on preventing harassment at work. We also the EU is also actually working closely with member states to improve the conditions for health workers and other regulated professions to move around, to establish their professional activity in the countries of their choice. You certainly may know that we work within the legislative framework of the Professional Qualification Directive. The experience of many years shows that health workers are the most mobile professional group in Europe. As you may imagine, that produces on one hand opportunities, on the other hand certain challenges, because mobility can exacerbate shortages in those member states who actually produce the health workers for other more attractive countries. There have been some revision of this legislative framework, giving the EU more flexibility to adapt it to the needs. So, for example, for a few years, we've been working to make the rules of defining the minimum training requirements more flexible for certain professional groups. There has been a revision of these requirements recently for nurses and pharmacists. There is some ongoing work also for midwives, and we are also looking towards putting a minimum training requirements also for physiotherapists. So this is something which will come very soon. We also put in place a lot of mechanisms to improve the intra-EU mobility, because recognizing qualifications is just one issue. Another issue is to ensure that we have coherence in terms of access to social protection, but also easier mobility for learners. So there are a lot of initiatives which have been taken to improve this intra-EU mobility. The EU is also attracting talent from abroad. I know that in the health sector, it can be quite actually challenging for the third countries, because we should not hire, of course, health workers from countries which struggle with the universal health coverage. And this is, of course, at the core of our considerations in the new EU migration package. This migration package is actually putting in place specific instruments to improve the chances for the interested third country workers, including in the health and care sector, to get jobs in the EU. Another important recent strategy was the care strategy. Of course, we have to work hand in hand with the long-term care sector, because the challenges are common for health workers. We use the same resources very often, especially nurses, to address the needs for care, whether healthcare or long-term care. So we work hand in hand also with this initiative. A recent development is also a forecasting model for the health workforce needs. It will allow us to have a solid estimation of the needed health workforce with the perspective 2070. And we just issued the report which explains the methodology we are going to use, and the first results of this estimation will be available in September. What are the more targeted actions which we put in place? So we've been working with member states, creating for them a certain platform to exchange their experience, to look together for the solutions to the more sensitive issues like the medical deserts, retention of staff, and task shifting. The cluster of 5 projects which supported member states in this work has just ended and produced very interesting results. You can have a look. I provide you the links in the slides. Actually, one of the most important conclusions is that we need place-based approaches to solve challenges in these areas. So it would be extremely difficult for the EU to step in and find a solution to the medical deserts, for example, or to the task shifting. It requires solutions which are actually very sensitive to the local context. Another big initiative which is ongoing is the Joint Action Heroes on health workforce planning. It's the continuation of our efforts. There was already one joint action in the past. There was a big project SEPEN in the past. What we aim for with this action is actually to make sure that we build capacities in member states for the effective use of the health workforce planning in their policies. Another initiative which I already mentioned is the nurses retention action. It's for the very first time that the EU is proposing the action dedicated to to nurses. It's the very important one because shortages and working conditions challenges are more acute for nurses than for doctors. So we decided to put a standalone initiative for them. We also work with member states on skills, and at the core of this effort is the Be Well project. This is one of the initiatives under the skills agenda of the Commission, which was also renewed at the outset of the corona pandemic crisis. And this initiative has already established the partnership of various stakeholders representing health professionals, education sector, working on the skills agenda. This agenda will identify the needs of the future, focusing in particular on the digital and green transition. This initiative is also testing innovative curricula in the health sector. And we also put in place some complementary actions, training actions, which are the cross-European training actions with the focus on digital skills, actually. That was the interest, which was actually flagged by healthcare professional associations in the preparatory work for this initiative. And it offers training initiatives in at least 5 member states. Each of them, we have 7 projects with modules for doctors, GPs, specialists, nurses, and non-clinical staff. And they cover various areas. You can also have a look if you are interested through the links I provide. But they basically provide training opportunities for cancer care, antimicrobial resistance, hospital of the future, and more generic projects focused on basic and advanced digital skills. We have also about 70 initiatives under the EU for Health project, which offer program which offer training and capacity building opportunities for health workers. And as you may imagine, they are closely linked to the priority areas of the EU Health Union, which I mentioned in the beginning. I also mentioned that we try to strengthen our collaboration with member states, and we have an operating platform, HSPA, Health System Performance Assessment Working Expert Group, with which we've been working for almost 10 years now. And actually, they decided to work since last year on health workforce. And we just agreed with them that this work will focus on minimum staffing levels. So there is some interesting work to come from this. When it comes to the European semester, this is the mechanism of our collaboration with member states, each of them and all of them. And the semester has played quite a critical role at flagging the challenges related to health workforce. So in the 4 last cycles, 18 member states have received the country-specific recommendations which call for the efforts to improve challenges, to improve the situation of health workers. And what is very closely linked with the semester is the new funding instrument, which is part of the financial framework for the recovery from the crisis, the Recovery and Resilience Facility. And this works very closely. Well, this works in complementarity with the EU for Health actions, but its specificity is that it is designed for the specific member states' needs. And the health and recovery resilience plans, which were submitted by member states 2 years ago, include quite an important and broad actions on workforce, including reforms to improve the working conditions, like in Austria, Bulgaria, or Spain, but also specific investments, mainly in skills, but also for health workforce planning, like in Malta, and any specific platforms for collaboration of health workers, like Spain. And you can see more details on the slide. I should not take more time, I realize. So just to conclude, the EU, I hope I explained to you how the EU contributes to the health workforce agenda. It's both through policy development and providing different tools, including funding mechanisms. What I would like to stress, there is no one-fits-all solution. That's why we need actually to work together at all the levels. Thank you so much, and I look forward to other presentations and to the discussion.
Thank you so much, Kasia, for this very comprehensive overview of what the European Commission is doing in the area of health and care workforce. And I really appreciate the fact that now the Commission is taking a more integrated approach of the health and care workforce. Thank you for the effort. I know there's a lot of things that are happening. And now we're moving to the next speaker, who is Professor Tiago Correa from the Institute of Hygiene and Tropical Medicine at Nova Lisbon University in Portugal. He's also the Vice President of the Health and Care Workforce Section at EUPHA, and also the Director of the WHO Collaborating Center on Health Workforce Policy and Planning. Tiago, we're happy to have you with us. I kindly ask that we try to stick in time so that we have a bit of time for the question and discussion at the end. You have the floor, Tiago.
Thank you so much, Marius. Good morning to you. Good morning, everyone. I'm now trying to show you my presentation. Just one moment, please. You are not seeing my presentation, or are you seeing it?
We are not seeing it yet.
But I've uploaded. So I kindly ask the support, our backstage support. I'm from my side. I'm connecting my presentation. I'm uploading my presentation. So I really don't know why you cannot see it.
Let's see if Karina maybe can help us with this.
I kindly ask that, please. I'm really sorry for this delay. So eventually, should I begin without the presentation, Marius?
Yes, maybe we can do that so that we don't waste the time, and maybe in the meantime, Karina can help us with the presentation. Yes, please go ahead, Tiago.
Yeah. So it's really a shame that you cannot see my presentation. Oh, no, yeah, it's working now. Thank you so much. So good morning, everyone, again. Obviously, I have to thank EUPHA and the organizers for this session as part of the preparatory webinars for the 2024 European Public Health Conference. And the topic of the health workforce is extremely important, is under the spotlight, as you can saw by Kasia's presentation. But differently from Kasia, who brought us a very nice overview, I decided to narrow down a bit the focus of my argument today. So, and I already expressed that to the organizers, notably to Marius, that my intention was to address a very specific topic when thinking about this issue of moving from data to action. So therefore, I decided to bring up the topic of vaccine hesitancy and its relevance to the workforce. And this is actually a joint reflection that we conducted in an European funded project, the EUPHANxt project, in which two Portuguese teams, one from the Institute of Hygiene and Tropical Medicine and another from the Institute of Social Sciences, were responsible for evaluating interventions and drafting recommendations in Europe. You can find here the list of the persons who were involved. Any questions or comments can be directed to me, and I obviously will pass them on to the team. So, the aim and scope of this presentation basically is to argue for frontline health and care workers training as a cross-country strategic evidence-based policy with potentially positive impacts to vaccine hesitancy. The political background is now marked by the absence of policies to handle with vaccine hesitancy as a growing and as a complex phenomena crisscrossed by various factors. And also, obviously, vaccines, in our opinion, should be viewed also as both as from an individual and a public health, public good perspective. It means that both political actions and communities' engagements are required. Regarding the definition of vaccine hesitancy, the most widely accepted definition was authored by the WHO in 2014, meaning the delay in acceptance or refusal of vaccines despite the availability of vaccination services. The impacts are obviously clear and complex. Lower capacity for health systems to handle with vaccine-preventable diseases, and also the worsening of other health conditions. The complexity about vaccine hesitancy is that one-size-fits-all approach does not work in vaccine hesitancy, and this clearly links to what Kasia also said from a more broader perspective. In regarding vaccination, this means that variations are seen regarding time, reasons, target groups, and also vaccines themselves. Moreover, the recent debates highlight the need to evolve the concept of hesitancy to include varying levels of reflexivity. What does this mean? It means that we need to have, include in the concept, a greater understanding and attention to intentions, motivations, beliefs, and willingness. So, the thing is that previous studies have already identified some important policy gaps, including effective policy formulation remains fragmented at international, national, and local levels. Also, that political difficulties cross different governance levels. Here I'm mentioning the fact that countries adopt their own national strategies, often lacking scientific support and showing significant territorial variations even within countries. There are mixed approaches. Here I refer to different processes and outcomes. For instance, you can think of having mandatory versus voluntary vaccination measures, having selective versus universal immunization programs, or even having vaccines being administered by restricted or broader professional groups. The fourth point is the limited transferability of learning both within and between countries. So the point of overcoming these gaps was basically what the project EUPHANxt project tried to handle. So the project lasted between 2021 until 2024, so it's already finished, and it was conducted in 7 European countries to try to support healthcare professionals in engaging with vaccine-hesitant individuals. It included several methodologies, one of which was the Delphi panel, which is a participatory consensus-building methodology to translate scientific evidence into policy recommendation, and we surveyed 112 experts and stakeholders from various sectors. We conducted also a principal component analysis to lead what we named here as the A-star model. So Here is a detailed description of the final list of the 16 recommendations that received a high consensus level to be included in the ASTAR model. As you understand, I don't have the opportunity to go into detail on these recommendations, but I can briefly explain what ASTAR stands for. It stands for awareness, in the sense that authorities should help professionals to raise awareness on users' doubts about vaccines, support, ensure that information about immunization is accessible to everyone, training, enhance communication skills about vaccination and vaccines in healthcare curricula, agency, recognize and respect users' individuality and autonomy in clinical encounters, recognition, acknowledge, and respect diverse lifestyles and practices without negative judgment, engagement, build a collaborative relationship between professionals and vaccine hesitant users through more personalized strategies. Among these 6 dimensions, training was the one that collected the higher consensus from the experts across the 7 countries. So, therefore, the next step was to look at these training sessions. The project developed, actually designed, implemented, and evaluated in the 7 countries several training sessions, including almost 700 participants among GPs, pediatricians, nurses, and students. 2 main types of training were implemented: asynchronous and in-person sessions. Regarding the outcomes, so 3 outcomes are possible to draw from this learning. One is the real need of effective strategies for professionals to address communication challenges with vaccine hesitant individuals. It is clear the need to acknowledge key barriers in communication. One is that the authoritarian tone from professionals impacts on patients' perceptions, obviously impacts negatively on patients' perceptions. Other is that patients often feel unheard and lack clear answers to their own concerns. Another one is the lack of or having contradictory information on adverse effects of vaccines. So, effective strategies must include emotional and relational aspects. By this, I mean the fact of patients seeking comfort, empathy, and partnership in decision-making. Also, the need of a supportive environment to boost patients' confidence. And here you can think of things like new work models or even having different architectural adaptations in infrastructures. The second outcome in blue is the need of evidence-based communication practices to improve interactions with vaccine-hesitant individuals. Here, I want to highlight motivational interviewing as a means of rapport building, active listening, to formulate open-ended questions, and to reach empathy. Motivational interviewing establishes trust and connection, validates feelings and concerns, uncover underlying issues, and demonstrate understanding and support. The third and final outcome in green is the strengthening of social scientific knowledge of healthcare professionals in the context of vaccination. In practical terms, it means equipping professionals with a comprehensive, what some might call as a system thinking approach to vaccine hesitancy. It includes things such as better sense of social determinants impacting on vaccine hesitancy. But social scientific knowledge also contributes by fostering collaborative or co-creative approaches, including methodologies like World Cafe and others, that help to better identify and frame cultural, behavioral, and attitudinal factors influencing vaccination. So, my last slide, and to conclude, our take-home messages from this project is that obviously health and care professionals need to access training initiatives, and this should happen at the early stage of their careers and throughout their professional lives. The second place, key training goals should empower for action, should deepen and refresh knowledge, should foster reflection, and should be able to change attitudes, professionals' attitudes, and also the ability of professionals to change users' attitudes. In the third place, having effective learning context. Think of very practical examples as having in-session, in-presence sessions, having small groups, having a balance between theory, practical approaches, and space for creativity, having also simulations and case analysis, which are very effective strategies. In the fourth place, managing expectations, notably professionals' expectations. It is required when developing this kind of initiatives to clearly present objectives, content, and methodologies, and these pedagogical approaches to training will foster professionals' engagement in these sessions. Also be aware of professional needs. Professionals might require different educational materials, complementary sources of information about specific topics, and also to have very practical tools for their daily practice. In the sixth place, to have to foster engagement strategies. So it's very important to understand that healthcare professionals need activities involving and boosting their creativity and participation. And this is, in the end, is a way to foster their own reflexivity about the context, about users, and about vaccines themselves. So basically, this is what I had for you today. Thank you so much for your attention.
Thank you very much, Tiago. Thank you for joining us and for this very important presentation. I appreciate very much the fact that you, as a take-home message, put the professional needs as well, because we have to take them into consideration in everything that we're doing, especially if we're training them. And now I would like to introduce the last speaker for the day, Shlakshana Nandi, which is a technical officer in human resources for health field at the WHO regional office for Europe. Shlakshana holds a PhD in public health and has over 25 years of experience in working as a public health practitioner, researcher, and educator. Shlakshana, the stage is yours. Thank you for joining us.
Sorry, Slashka, you need to.
Oh, I'm sorry. Yeah, I'm sorry. I was trying to fix my light, but that's it's a perpetual problem, but it's fine. So thank you very much for the invitation, and it's really special to be within the public, with you, the public health community, because being a public health professional myself. So what I will share today is sort of some insights, some tools, some instruments that that you can use, that you can actually also incorporate in your research, that is being done, and then how to develop them into policy, policy interventions, and finally in implementing policies for bettering the situation of the health workforce in the region and elsewhere, and also then monitoring and trying to look at the impact of such acts and of such policies. So I will sort of just share some snippets, and I will focus mainly on retention and migration, and also share the process that we at WHO use to work on these issues. But starting from the Time to Act report, which I'm sure most of you are aware of, which was really quite a sort of an important report which described the situation of the health and care workforce, and really started this also kind of political momentum within the region to improve the health and care workforce in the region, particularly learning from the lessons from COVID-19. So I will really very quickly go through some of these slides and focus more on the research and action bit. So the report made headlines, and some of the data that we presented in the report that has been since then updated really shows that while there have been some improvements in some countries in terms of increase in density of of doctors. However, when we look at the density of GPs, we find that in 17 countries in the Euro region, the density has reduced. When we look at nurses, again, I mean, as Kasia has said, retention of nurses is a concern, and we see that while there is an increase in the density of nurses in many countries, there is also a decrease in nurses in many of the countries of our region. And some of the other highlights and some of the other pressing issues that come to the fore, one is the issue of the aging health workforce, which is also very much related to attracting younger people to the profession of health and social care. I want to in this series of really highlighting some of the issues that the region is faced with, want to emphasize also on the gender aspect, and we find that the proportion of women health workers is increasing, and we also find there is a gender equity crisis, whereas the leadership positions are not equally distributed as per the proportion of women in the health workforce. There is 24% pay gap, 30% face sexual harassment, and there's higher risk of violence for women in the health workforce. And I also want to add that there is also an intersectionality angle to this, in which when you have women who from with different the diversities within working within the health workforce, all these issues also become more severe for them. So finally, when we look at the shortages of the health workforce, and this is sort of a illustration, a representation of what I have talked about previously, and I think also all this data basically led to this political momentum also within the region, in which the Bucharest Declaration was signed, and finally culminating into the adoption of the new framework for action on the health and care workforce, which I'll go into a bit more detail in a bit. But just to also add that the framework for action is really significant for the region, and the European Union has also included it in their conclusions on the future of Europe, and that and the WHO Code of International Recruitment, which I will also talk about a bit later. So just to briefly share the pillars of the framework, which you may have already, you would be already familiar with, but we put the health worker at the center of the framework, with retain and recruit as the core pillar. And you would see that we have put retain as the first word before recruit, because that is, really where a lot of our energies need to go. And then the second pillar is building supply of health workers. The third is optimizing performance. The fourth is planning. And the fifth, which is really, really critical, is investing in the health workforce, in healthcare, looking at how budgets, looking at budgets and looking at health workforce as an investment in the health and well-being of people of a country. And one of the ways that we use data in developing an understanding within countries and supporting countries in understanding, where they stand is the health labor market analysis. And I'm going to share a lot of concepts, but they all, I have added links to all the slides so that you can also go and read them when you have the time. So the health labor market analysis basically helps countries, and we support countries through this approach in really identify the policy questions, the priorities that they want to, policy questions that they want some answers to in terms of research, and then and also in terms of future action plan, workforce strategies. So all these basically emerge out of the health labor market process in which this data analysis is done, and then policy recommendations and considerations developed. So now I'll just go very briefly. I will try to go to two topics which I think we've also been hearing a lot, and all of you, it's a concern for all of us. So one is the issue of retention, and the other is the issue on migration. So in terms of retention, one of the tools that I want to share with you is the WHO guidelines on health workforce retention. And it is really, I think, significant to understand that while these guidelines have this four set of dimensions, in terms of the kinds of policies that can be used to improve retention. It looks at education policies, it looks at regulation, it looks at incentives, and it also proposes professional and personal support. But the most important thing within this is the idea that implementing or making policies on one thing will really not give you the kind of impact that you want. So it's important to have a bundle of policy interventions that includes more than one of these incentives and interventions, and that's how it's really going to make a positive impact. And I want to just share an example of this compendium of case studies that I was involved in a few years back in the Southeast Asia region, and I would really encourage you to go and read up these case studies, because they really provide a lot of detail on how countries have sort of successfully implemented certain retention policies. And while I know that the context may be different, but in terms of principles, they're very, very similar wherever you go in the world. So this is one case study. This was in Chhattisgarh in India, in which, like I had said, there's a bundle of interventions, which included financial interventions, which included giving marks for postgraduate admission, which included, providing transport, job to spouse, residence facilities, strengthening the health facilities, which, often when we talk about the health workforce, this is sometimes, this really does not come up right in front, but having a kind of the systems thinking that Tiago mentioned. So improving the systems for healthcare, improving infrastructure, ensuring the equipment, the medicines, the staff is available, really goes a long way in motivating the health workforce and retaining them. Then improvement to the organizational culture, and then there was some decentralization recruitment that really worked. So it led to, as you can see in the orange bars, led to an increase in the number of health workers in that region, and also I'm sorry, it's all got skewed somehow, but also increase in the number of persons availing services of outpatient and inpatient, which is ultimately what we are aiming for, right? For services to be more available for people and community. So the second theme that I wanted to share, talk about is migration, and I think I'll just go through this very fast because I know I must be now over time. But this is to say that there is a report that WHO has brought out, and it provides various estimations of the health workers. At least 2.7 million health workers are supposed to be working outside their country of birth or first professional qualification, and this is very significant for the Euro region because 10 high-income countries host 64% of the migrant doctors and 46% of the migrant nurses. And I want to also then share that this is something that WHO has been looking at, and in 2010, the WHO Global Code of Practice was approved, and which aimed to establish principles and practices for ethical international recruitment of health workers, and which has these guiding principles. I mean, some of it, what Kasia was also mentioning in terms of migration, how, what are the considerations that countries need to take into account before, recruiting health workers from other countries, particularly those countries in the global south who are struggling themselves. So when we, so that is one of the codes of practice, one thing on the code of practice that I really encourage you to read. The second document that has come out is the emerging recommendations of the WHO, the guidelines on bilateral agreements. That's again a very new document, and you can find it online, and the link is here. So some of the policy actions on migration that have emerged from the data and from these consultations is that, again, investing in education, employment, and retention of health workers within the country to meet national needs. And that's really primary, and in improving the national pull factors, the working conditions, the pay to retain health workers, and like I said, through the health labor market analysis and other mechanisms, this is where we support countries also. Then ensuring the planning mechanisms are in place and ensure that the bilateral agreements, are benefiting all sides. And we've also put out a call for all stakeholders to participate in the fifth round of reporting on the code implementation that will be reported next year in the World Health Assembly. So my last slide, going back to data and impact. And just to say that within the framework for action, we have a section on an accountability framework, and there are proposed indicators. So for us, and I think for all of us, it's very important that whatever work we are doing, it needs to make an impact, and the way to, and there has to be a way to measure it throughout. So please engage with the framework for action, engage with the document, support your countries to implement it, and also do engage with the accountability framework and the indicators in terms of research. Thank you very much.
Thank you so much, Sulakshana, and thank you for all the presenters. I believe that we had quite a a diverse perspective on health and care workforce pressing issues of the moment. And it's so many things that we could discuss on. And I've been following the comments on social media, on the various social media channels where the webinar is being live streamed. I've seen a comment with regards to the situation of nurses, training of nurses with regards to vaccine hesitancy, also regarding shortages and mobility of nurses. And these are all aspects that have been tackled by your presentations. And I really love that they all fit in together very well, because Tiago focused specifically on vaccine hesitancy and the need for training of health professionals. Sulakshana then provided a broad overview at the European WHO region and focusing on the policy actions. And also Kasia presented the myriad of initiatives that the European Commission is taking in order to tackle pressing health and care workforce challenges. And so I would try to include the comments and questions from social media. And I'd like to kindly ask each one of you to reflect a little bit on one of the things that I've taken from one of the papers, one of the editorials that colleagues from the WHO have authored just not so long ago, and that is very beautifully titled "Moving from the Health and Care Workforce Crisis to the Health and Care Workforce Success." And there are a couple of points and that are presented in Sulakshana's presentation on how to move from these multiple crises, because we speak about multiple, we are facing multiple crises. And so how do we move from crisis to success? And if you are kind enough, maybe in the same order in which you presented, Kasia, followed by Tiago, and then followed by Sulakshana, what is your one take-home message based on the work that you're doing that we can do to move from crisis to success in the field of health and care workforce? Kasia?
Thank you so much, Marius. I think I would like to repeat what I said at the end of my presentation, that I think that the crisis created a lot of opportunities to work together, to strengthen the collaboration. This is really what I have seen since the pandemic. So I think that we have to grow together, and this is actually our strength. I think that before that we've been very much working in the silo configuration, and that has changed quite a lot. And this is what I'm very happy about. I think that each of us at various levels can play their role. And we are stronger if we come together and we discuss together. We can see how we can build synergies rather than sometimes doing things which go into the opposite direction. So I think that this is quite positive, and this can turn this crisis into the success, hopefully.
Thanks so much, Kasia. I really love this idea that the fact that in every crisis, there's an opportunity for improvement. There's an opportunity to do things better than before that. Tiago?
Yes, in my understanding, the thing is that we are talking for at least the past 20 years. Some of these crises have been mentioned in the literature. Some of these crises are new, but some are not new. What really strikes me is how to explain the situation of having at least two generations of scholars mentioning the issues of the health workforce, and in 2024 we are still facing some of these old issues. The way to move forward, in my view, it requires a continuous advocacy for the health workforce at different levels, international level, national level, local level. Also to make decision makers held accountable for meeting or not what the evidence requires and says as a very important way to handle with these old and new crises. And for this to happen, we have to have stable lines of funding to conduct systematic research and research that crosses different countries in different regions of the world. And I think having advocacy, having a stronger voice and making decision makers held accountable, and having the resources for researchers and communities to produce more evidence and more implementation evidence, I believe it's a way to move forward to overcome this old crisis and to really to focus on new crises and to overcome them as well. Thank you.
Thanks a lot, Tiago. This really is important to have implementation evidence, and this speaks to the very topic of this webinar, which is from moving from evidence to action and back, because as we all know, implementation in its turn generates rich evidence that can then inform the adjustment of any policies or actions that we're doing. Thanks so much. And last but not least, Surakshana.
Yeah, thanks. I echo what Tiago and Kasia have said. And I think in terms of opportunity, this is like I was saying, there is this political commitment, there is this political momentum on working, with the health workforce put in the center of implementation and research. So I think within this, I think the first thing I would say is supporting countries to really build an understanding of what is happening within the country, building evidence on what's happening within the country, and then developing evidence-based policies, and then going on to implementation and then monitoring their impact. So that is one line of work that is really needed. The second would be then organizing this work at the regional level and maybe even at the global level, because as we have seen in the presentations, this is something that is affecting all countries, even within the WHO European region, but also globally, because there's so many, workers, a large number of workers who are coming from elsewhere in the world. So I think WHO is also very well placed, and it does play that role in bringing these things together, so that countries can learn from each other, not only within the region, but even across the regions, because the problems we are facing are the same, and the solutions at the level of principles, etc., are very similar. Of course, they have to be contextualized, but this kind of sharing and working together and collaboration that Katya was talking about, I think is really critical, and including with health workers themselves, listening to their voices. I think that's really important. Yeah, thank you.
Thanks a lot. Thanks a lot for this remark, and also adding in one comment that we received on LinkedIn from Kate Tulenko, adding in not only the public sector but also the private sector, and that only fits very well with what you mentioned, Surakshana, about learning from one another and learning together. So there's no better message to wrap this comment section, and then give the floor to Monica.
Thank you very much, Marius. Thank you, Tiago, Kasia, Surakshana. As the EUPHANxt coordinator, the next generation network of public health professionals, I must say that I agree with all of you, and I will pick up on something that Marius said, that we need to learn from each other and we need to collaborate, but intergenerationally. We need to capitalize on the enthusiasm, on the willingness, on the energy of the youth, and on the expertise of those that are already well established in the field. We need to work together to maximize our outcomes. And I'll also pick up on something that Surakshana said. We see that for young people, health is a less and less attractive field. We need to think of ways of attracting them, because if not, in the next few years, we'll be in a very unpleasant situation, that of medical deserts that Kasia mentioned. So we really need to think of how we can create these oases, health oases, in which we work together and we collaborate and make sure that everyone is taken care of and no one is left behind. With this being said, thank you very much for everyone that attended, that left comments for us, that had remarks, that shared their thoughts with us. Thank you very much. I would very much like to thank you, Marius, for being such a great moderator. Thank you, Marius. And of course, our esteemed speakers. Thank you very much. And now I would like to give the word to Karina. Karina, please.
Thank you so much, Monica and Marius, and all the rest of the speakers, the Kasia, Tiago, and Sorana, to being us today. And it was a very interesting and inspiring webinar about health and care workforce. And I hope to continue this kind of discussions in the conference. So this webinar will be available in the European Conference website and social platforms. So without further, I will try to continue this webinar with a quiz. And I just need to remove our speakers and see you soon in Lisbon. And I will share the quiz in a few minutes. I hope you enjoyed the webinar and the quiz. I'm sorry for technical issues. I'm trying to show the quiz. And I advise you to use the mobile to do the quiz because of delay. And I hope you are seeing. Just a moment. Oops, sorry, not the first one. I think the people are coming. We wait for a few minutes to people to connect. You can use the Azad slides, EUPHA Lisbon, to connect. And we already have 2 players, 3 players ready to start the quiz. I'm waiting for more audience to be more useful. Just 3 people. Anyone wants to join us to this quiz? We have more time, 1 people more. I hope more people are enjoying. I want to start this quiz and to give another interest to our dinner and dance gala. You didn't see you can also go to slides.com, HP Lisbon, to connect the, I will put the link in the comments. Just a few minutes, sorry for this delay. I don't know if you already has the link one. You can use also the code. And I just wait more 1-2 minutes and started this quiz. We have like 6 players. I hope the people can enjoy during the quiz. You can also answer the questions. It's better if you are faster. The points is selected by this one, and correct and unfastened answers earn more points. And in the end, we have like a speed wheel to also offer again another ticket. So we already have 10 players. I will start it. I remember again, it's better to use a mobile to see the question in correct time, not in the streaming. And let's start the quiz. So the first questions. Which are the most effective strategies for health workforce retention and attraction in rural and remote areas? First, enroll students and rural background in health work education, expand range of health worker occupation to meet rural health needs, provide a package of attractive incentives, and the last question I try to almost the persons select the correct answer. I couldn't read all the time, so let's see who leader the board. Helder is leader, and Monica the next one, Elizabeth in the third, Marianne in the fourth. Let's go to the second question. Which are not the pillars in the framework for action of the health and care workforce for the European region? One of the speakers speak about that. You can select one of these: retain and recruit, building supply, invest in, optimize performance and workers. So let's time's up. Let's go to the answers and the result. The answer is the last one. So we have the leader, the new leader, Elizabeth, the second, Katerina Ostrova, and Francisco in the third place. Let's go to the third question. This is a different question. This is just true and false. Vaccine hesitancy means to delay in acceptance for refusal and vaccines regardless of the availability of a vaccine service. Is true or false this sentence? Time up. So is false this sentence, because it's not regardless. The availability of the vaccination service is more despite of the availability of the vaccine service. So let's go to the lead. Oh, Francisco is rocking the longest streak, so is in the first place, Marianne in the second, and Mavik in the third. Let's go to the next question. Again, true or false question. According to the findings of EUPHANxt project, healthcare professional training was a key and crossing dimension to address vaccine hesitation in the select European countries. Is true or false? So let's go, and what do you think is time's up? Show the answer. So very nice. All the people select the correct answer. Is true this sentence. So let's change the leaderboard. Okay, a little bit. Francisco stays in the lead, and Eric in second, Elizabeth in the third. Let's go to the next question. Where and when was the first annual scientific conference organized by EUPHA? Paris 1992, Lisbon 2008, Brussels 2001, Maastricht 1993. So what do you think? Yes, it was in Paris, the first annual scientific conference. In Lisbon was the first European conference. So let's see what changed the leaderboard. And Francisco continued leading with the rocking the longest streak, and Mariana the second, Enrique the third. Let's next. How many countries are represented in our network, in EUPHA network? So it will be 55, 25, 47, and 37 countries. So the answers, yes, indeed, 47 countries. So let's go to see who continued the leadership. Francisco is continue, Mariana the second, Helder the third, and Eric the fourth place. So it's nothing changed in the last questions. Let's see this. The next question: who is the president of EUPHA Infection Diseases and Control Section? We have 4 names: Aura Timan, Michael Anderson, Maria Gazak, Ricardo Mexia. I hope everyone select the correct answer. Yes, it is Ricardo Mexia, our chair of this conference in Lisbon. So let's see the leaderboard. Okay, anything a little bit changes. Francisco continues, Mariana in the second, Eric and Elizabeth showing in the first place. One more question. The EUPHA Health Work section came from which section? I don't know if you, oh, sorry. I don't know if you know. Started, sorry. Which section? Sorry, I need to wait a little. And EUPHA HTI, EUPHA HCR, EUPHA HP, EUPHA AP. And yes, is the EUPHA Health Service Research is the correct answer, and the leaderboard is continue a little bit the same with Elizabeth in the second. Continue the questions, the 9 questions. Which one section of EUPHA ceases to exist? Mental health, utilization of medicines, oral health, urban public health. You have enough time to answer correct these questions. So show the answer. Yes, it was utilization of medicines is ceases to exist. The leaderboard, we have continue Francisco, Elizabeth in the second, Maria in the third. Let's continue. We're almost in the end. Just more 3 questions. Who started the EUPHA Public Health Monitoring and Reporting section? Martin McKee, Mariki Verdschuren, Eva Nagyova, Julian Mamo. So what's your answer? Yeah, okay, it's not so a little bit distribution, but it was Mariki. The leaderboard, what's changed? Okay, Monica is rocking the longest stick, but the Francisco still in the leading of this quiz. Question 11. What year was EUPHANxt created? This is for the EUPHANxt followers. Don't lose this opportunity. 2001, 2011, 2020, 2021, 2010. Which year? Yes, is 2011. So let's go to see the leadership again. Yes, Monica is rocking the longest streak, but Francisco still in the first place, Elizabeth in the second. Just more 2 questions. Which iconic tower in Lisbon, located in Belém district, was built in the early 16th century as part of city defense system and is now an UNESCO World Heritage Site? Belém Tower, Vasco da Gama Tower, Lisbon Cathedral, St. George's Castle. So what do you think? Yes, it is Belém Tower, how it shows in the picture. Let's continue, and the leaderboard is not changing. Francisco in the first place, Elizabeth in second, Maria in the third. The last question: when is the deadline for abstract change? This is how the people who wants to present the abstracts in the EUPHA conference, 15th of July, today, 20th of July, 25th of July, or 30th of July. I hope everyone select the correct answer. Yes, it's today. Don't forget, today is the deadline to change the abstracts and to have a registration in the conference. Who is the presenter in the conference? So Francisco wins again the quiz, and I think it's in the small and the short place to get the final ticket to have this ticket to go to the European conference. So in the end, we will go to the spring wheel to offer one more ticket. Let's see who's to win another entrance to gala dinner. Oops, sorry, we need to show. I think all the people say. Let's see. Okay, Eleni. So Eleni, in the future you will be contacted to receive your interest to gala dinner, to dancer and dinner in Stupa Fria. So in the end, what word you use to describe this webinar? I'm waiting for your comments with this webinar, with our codes. The participating are typing, so I'm waiting for your evaluations. What do you think? What do you describe about this webinar? Work for cool. Interesting, informative, capacity, relevant, fabulous. Okay. I hope you enjoyed this webinar as I am, and I hope to see you in Lisbon. And thank you so much, our speakers, our sponsor, and you also to be present in this webinar. I hope to see you soon in the next webinar, and in November in the conference, the European Conference of Public Health. So thank you so much, and see you soon.